Hi everyone, welcome to this fortnightly Tools for Frontline staff session. We've got two presentations today. So Will and Daryl are here from Connect to Us, and we've got Sarah from the public health team at Hackney to talk about public health dashboards. So yeah, I'm going to hand over to Will now, and thanks for coming along, Will.
No, my pleasure. I think I've sent some slides over. I mean, there's only a couple, but if you could, it's possible to put them up. If not, I'm sure I can.
Give me 1 sec.
No worries.
Just struggling to find them. 1 sec.
No worries.
I'm not sure I've got them, Will. Were they in the same thread we were already emailing it?
They were. Do you want me just to share my screen?
Yeah, is that all right? Thank you.
Bear with me a second. There we go. Can you see that okay?
Yeah, we've got it, yeah.
It doesn't very often work first time, so I'm actually quite impressed with myself on doing that.
Yeah, good.
Just a little bit about who we are, first of all. So some of you may well know, some of you may not well know. We're a joint venture, Connect Hackney, and we went live on June the 30th.
Well, sorry, really sorry to cut in. I think if you hit slideshow at the top, just where your mouse is now, it'll make it a bit bigger. Yeah,
I told you it went too smoothly. So essentially, we were all contract recruitment in the past in Hackney Council has been run by a vendor called Matrix. We were brought in June, went live on June the 30th, and we're actually a joint venture, part owned by Hackney Council. It's to bring control back into Hackney Council for all recruitment, essentially for all contract recruitment. And one of the big drivers for us is going to be finding local, basically jobs for local people. I think that's one of the main reasons we've come on now, is to try and help you guys find work. But just a little bit breakdown of how the team works. So I'm the business manager. We're based in the service centre, and the team is split into essentially two. So we've got an operations team, and they deal with our agencies. So the roles that we can't fill ourselves internally, we will put out to agencies. But the idea of the team is that we fill any contract roles ourselves. So we're split into, we've got 4 talent partners, one who looks after our qualified social work side, one who looks after our management interim side, then we have our trades and ops, and then I've got Daryl on the call, who's our business office admin side. So Daryl, if you just want to introduce yourself, I thought that'd be good.
Hi guys, so yeah, my name's Daryl. I'm a talent partner at Connect to Hackney, also a Hackney resident, have been my whole life. So really passionate about this whole project, trying to find and source relevant candidates who predominantly live in the area, keeping talent local. So yeah, that's a bit about what I do alongside 3 other talent partners who all deal with, different desks, different caliber of candidates. But besides placing people into the council, I'm also offering like interview advice, helping individuals CVs, and also recently started working with a couple of like charities, trying to get people into work, people with learning disabilities, people from disadvantaged backgrounds, people who just aren't given the opportunity. So yeah, that's pretty much what I do. And if you know anyone who's looking to get some CV advice or interview advice, feel free to send them my way.
I think that's the crux. Obviously, we're there to fill internal roles, but I think there's so much more that we could offer to the Hackney community, rather than just obviously put out a job advert, somebody applies, we put in. I think there's people out there that are struggling to find work, because I think it's key that we can help them. I think I'll move on to the second slide. I think just how can we help? So far, we've made around about 200 direct placements into the council, which is great. But we want to focus now more on, I think, jobs for the local community, and that's a real key driver for us. So, if you've got people that are looking for work at the moment, we can basically keep them in line with exactly what's going on in the council in terms of contract roles. So we get roles for all levels and all skill sets. We work with a waste depot right up to interim roles, interim managers, etc., etc. So there'll be people out there with all sorts of skill sets that we can find work for. As Daryl rightly said, we can help with CVs. We can give interview preparation for people that maybe been out of work for a long time, lost some confidence, not quite sure really how to go to an interview, how to behave, how to answer questions, how to come across. That's where we can come in. We can offer that advice. We can give weekly job updates to everybody. So we can bring the jobs to the people as opposed to people looking for jobs. It's not an easy thing to go out and look for a job. But if we can go to people and say, look, this is what we've got at the moment. Do you think there's anything suitable? Can we give you more advice in terms of what roles you've got? Then we could go down that route. Group support and workshops as well as one-to-one support. And I think that's key. I was lucky enough to be at the Connect to Work sessions today in the town hall. And a lot of sort of the conversation we had there really rung true. And there's a lot of people out there at the moment who aren't working that probably haven't got the confidence to want to go back into work, and probably think that their CV has got big gaps, and there's things there that we can really help with. And I think it's an education piece, it's a communication piece. We can really help to drive people back into work, and that comes with building confidence and self-belief. One of the key things we spoke about today is there might be some people that might have been stay-at-home mums for the last 3 or 4 years that think that puts them out of actually finding work. But stay-at-home mum, there's so many different transferable skills you're doing that some people will not actually look at that and think of that as a skill set. We can help grow that confidence, and someone can go into an interview and really sell themselves and talk about what they've done. And for us, it's all about helping to remove those barriers. It's installing confidence into people in the local community that actually, yes, we've got work. The biggest employer in the area is the local council. So, come and work with us. It's contract work. You could try the role. If it's set for you, then obviously we can move you and we can look at permanent roles within the council. I think the key driver for us is we can help how you want us to help. We can be as proactive as you want us to be and help the community to find work. And that's us in a nutshell. And welcome any questions.
Thanks, Will. Thanks, Darryl. Great presentation. Sounds like really good work. Charlie, do you want to come in?
I have a few questions, but I'll keep it quite brief. Do you have like any outreach capacity? So is the plan that you're willing to liaise people as they come to you and teams as they come to you, but can you send officers to places where residents are?
Yeah, absolutely.
Local groups.
That's one of the things we're keen to do. So whether it's going out to focus groups, if it's going out to job centres, if it's going out to career fairs, we've got that flexibility to work how you want us to work, essentially, because we're a very mobile team. We're a small team, but we're very mobile. So we're not going to really help people by being sat in the office, because some people haven't got access to come to us to pick up the phone, too busy to pick up the phone or respond to emails. So if it means we go out to a community centre and sit down with a group of people and again give advice and workshops that way, then again we will work how it fits best for the people.
I wonder what Alex is going to ask you, but just to follow it. So I've been working with Caroline on some outreach for around job opportunities. It'd be helpful if we touch base on that, I think, because there are some opportunities. We know that local organisations appreciate outreach. Particularly, we know that the food system, like we said, energy advisors there, it goes really well. That could work really well for you as well. So I'll drop you an email. Will,
yeah, absolutely.
I have all the other questions, but Alex, maybe you go next.
You might be asking the same question. You never know. I will. So I work for Hackney Food Bank. So a lot of our work that we do is not beyond just giving food. It's like why people in food poverty, and obviously employment and lack of jobs available for certain people is obviously is now becoming a consistent theme, certainly for certain generations, for certain people that affect at both ends of the scale. So I suppose going on for Charlie is a couple of things. One, would you be interested in sort of having a meeting and sort of seeing how we can link in and work together?
Absolutely.
And the second question is obviously work with a number of referral partners, and actually is there some contacts that I can share, because I think everyone on this call, they've all got things to do, but I can sort of put a couple in contact with you directly, because they refer to us, but we can see on their notes that they've got some long-term employment. So say sort of having to go 3 sides of the square, they can just come directly to you with you, as opposed to going to us and then us go to you and then you go to the business itself.
No, absolutely. And I think the beauty is because we work with Hackney Council, there's so many different skill sets that are needed that's why we're keen to speak to anybody. And it's all about advice. As I say, it's all about communication and offering that advice. And if people are worried or they think their backgrounds don't fit, often it can be a case that the square peg fits a round hole better than anything else. And I think sometimes people just need to realise that, if they think they're not suitable for a role, actually that doesn't actually mean they're not suitable for a role. If they come to us, we'll have a conversation with them, and we could put plans together for them. Yeah, definitely.
Is there employment? Wrong PhD. Is there an email I can get hold of you?
Yeah, I'll pop my email address onto the chat.
Perfect. Thank you, Will. Look forward to working with you.
Thanks.
Thanks, Alex. Neil.
Well, this isn't a question for now, but are you on the full floor at HSC?
Yeah, in the corner.
Oh,
Yeah.
Am I? Obviously not now. It's not who's better at home than there. I've got a couple of questions for you, not for this audience, so I'll pop around and see you. It is about
Please do. I'm in
local-
Monday to Thursday, so come over. Yeah.
All right, brilliant. I'll see you next week at some point. Cheers.
Yeah, nice. Neil.
Nice one. Thanks, Neil. Charlie, did you want to come back in?
I do. I have more questions. Sorry,
Yeah.
Will.
Go on.
So an offer we put out last week on this, no, 2 weeks ago on this call is we've been working with an energy organisation called Crew Energy to deliver energy advice in the borough. That's gone really well. We've delivered all over the borough, but we want to try and get someone from Hackney employed and trained up as an energy advisor. And we're right at the beginning of that work, but I wondered if we could have a conversation with you about how we can shape that. We want that person to have, be a local resident, have experience with local communities, because you can't teach that bit, but you can teach the energy advice bit. So I wondered if myself and my colleague Marcella might be able to have a chat with you about what you think about that.
Definitely, and I think what that will be worth me bringing in as well will be the Hackney Works team as well, because we could sort of work together on that. That will definitely be something, because we it's slightly different. I mean, they do a lot more with the external type works, but yeah, I can bring Hackney Works into that as well, because I'm sure they'll be able to help.
Fab. I'll email you both then. I'm seeing Caroline tomorrow. And my final question is, Darryl, you mentioned you were speaking to some organisations already. Which organisations are those out of interest?
So the most recent one is the H100 scheme, Hackney 100. I believe that they try and place 100 people into paid work every year. It's basic, just short-term, part-time hours, but it's something to go onto the CVs, something to build confidence. And there is another one. I can't remember the name just yet because they only reached out to me yesterday, but it's a very similar organisation. Apart from their background is learning disabilities, mental health. So trying to once again build up confidence in the workplace before going into a more long-term permanent role.
Thanks, Darryl. I'm just going to come in quickly, Jenny, and I'll come to you after, just off the back of Alex's question. Something that me and Alex have both been working on, and people within Neil's team in council tax, is what we're calling community money clinics. So we've done one of them, which is where the Here to Help team and the council tax team and a community partner or two went to the food bank in Dalston, because you've obviously got for want of a better phrase, a captive audience there. You've got people who are already there every week, and then you've got this other form of support there, above and beyond the food, which is sort of help with bills, help with benefits, that sort of thing. We're planning another one in theory, which will be on the November the 25th. So it might be too short notice, but I think the intention is to take that work forward and do them on a more regular basis. So I'm thinking maybe if you guys had capacity, you could come down, because it might add another element to that sort of support. Yep. You've got your support of your bills, support of your benefits, and then the sort of the route out of poverty, if you like, through work. So I can loop you into those conversations if that sounds.
Please, yeah. Thanks, John.
Cool, awesome. Jenny.
Yeah, and in addition to that, we also are convening with partners across the sector, including sort of led by the VCS in Woodbury Down, a drop-in for families living in temporary accommodation in the Woodbury Down area. It's running at the moment from the Edge Youth Club every other Monday from 1 till 3, and we have a lot of services represented, sort of in a really really warm, welcoming space where kids can play and have and they're across the road with play bus, so there's even people to look after the kids while they play and parents can come and have a chat at the desk. So it's a really nice environment to have a conversation about that. We had Hackney Works down there. We managed to get Hackney Works down there, and a lot of these things often happen accidentally. So, somebody was working from the Redmond Centre, and they had a conversation with somebody who'd been looking for work, who'd gone and paid for a whole load of courses that they needn't have paid for, like forklift driving courses, all this that they could have got support to pay for. So we know that there's a massive need, and it was just that so helpful for the employment advisor, who was then going, people don't know about these schemes. How do we make sure people are and these are people that are really struggling. So we'd love to have you down there to the TA advice drop-in as well.
That'd be great again.
Able to come down, because there's nothing like having like a service like yours alongside Hackney Works, where you can provide that wraparound, because you also then you learn as well about missing and where the gaps are and how you can support each other. I think, yeah, and we've got other services there. We've got Here to Help there. We've got the Children and Family Hubs are there, health visiting's there. So there's a whole really good range of services, and we're trying to strengthen that and sustain that as a wider offer. But I think, yeah, all these opportunities to do outreach, we've been having some really good outcomes from kind of going to where residents feel comfortable and safe and doing it like that. So please do make use of those.
I think that would be good. I think the key, like I mentioned earlier, the key thing is for some of these people, it's confidence. They don't feel confident sometimes that they can go back into work.
Yeah.
They might have been out of work for a couple of years, but what they've been doing, transferable skills, is a lot of the time it's that you're reading a job spec and the job spec's out of date anyway. It's about life skills, and it's just making people aware of that.
Well, my second question was actually to do with that, I suppose, and it was to do with the barriers. As someone who worked for a long time in children's social care and working with young people, I know a lot about when the young people that have some of the most significant barriers to getting work, and certainly they wouldn't necessarily see themselves with a career in the council. And I guess I'm interested in. There's lots of co-design opportunities for young people in our system, working on things, some of them increasingly, trying to get a system where we value that input and where people are paid for their time, young people and parents. There's a lot of those opportunities. And I was just interested in how you might connect to, say, if young people were involved in a co-design or co-production piece of work, or a user engagement participation, if they were involved in something like that, how that could then be a pathway to getting paid employment.
I think, again, it's experience, isn't it? I think it's something that, unfortunately, a lot of roles go by. They look at the CV and look at the experience that people have got, and that's not always the right way of doing things. But I think anything a young person does that can be documented that I think is relevant, or it doesn't always have to be relevant. It shows that they've done something slightly different, or they've thought outside the box, or they've brought some design skills, or used their skills to do something slightly different. We can help them to make sure that's put down properly on paper in a way that I think that people will see that as a benefit to what they do. But also as a team in who are based in Hackney, is our job as well. We would go to the hiring managers and we've met these guys, they're brilliant. You just need to interview them, and I think half the job is getting them through the door to actually meet these managers. And once the managers have met them, that's when they do a bit.
Well, yeah, because I was wondering if there was an opportunity then to provide, if some young people had been involved in some engagement where they'd been paid with love to shop vouchers or whatever, had an experience of doing something that's quite a professional skill, could that then, could it be worth your bit of the system connecting with those design projects to say, hey, you've had this experience, have you considered a job in the council? Here's some interesting, or to kind of outreach that. I just wondered if it was an interesting link.
I think that's where we could work again with Connect Hackney, because of these apprenticeships that come through, and I think it's just the guys need a break, don't they? Essentially, that's all they need. They just need that foot in the door so that they can actually go in and do their thing and prove themselves. And a lot of the time, they just don't get that. And I think that's what we do. If we can break down that barrier, we can break down that door, do our bit to try and just get them in front of people, and then the guys will wow them anyway once they're in. And I saw an article, it was last week, I think, where councils at the moment, the average age of council employees is going up and up and up, and young people just aren't joining councils. But I think that's just because they're not given the opportunity to do that.
That's a really good idea. Charlie's just mentioned Skyway, an organisation that does some really good employment work with young people who might be worth connecting to. But sounds like you and Charlie, and also Hannah, one of our other assistant conveners, will be able to link you up to some really good opportunities. So it sounds like a brilliant proactive service, and definitely need more Hackney residents and young people working in the council, and really supportive of the work. So thank you.
Thank you very much.
Thanks, Jenny. Does anyone else have any other questions for Will and Darryl before we move on? No? Okay. Well, thanks so much, Will and Darryl. That was really good stuff, and hope you've got some good opportunities to pursue as well. Cool. Right. We'll move on to our next item. So Sarah's here from Public Health. So please take it away.
Thank you. I'll just share my screen.
Great.
Hi everyone, thanks for having me at the meeting today. I'm Sarah Haylock, I'm the Senior Analyst in the Public Health team at Hackney Council, and I'm going to be talking about two interactive tools or dashboards that are available to yourselves, but also anyone who works inside or outside of the council. So I'm going to talk about what the new dashboards are, why we created them, when you might use them, and then how you can use them. So what are the new dashboards? I think there's maybe a little bit of overwhelming number of dashboards at the moment. There seems to be new ones every day. The new ones at the moment, the two that the City and Hackney Public Health team have created are called the Population in City and Hackney and the Health in City and Hackney, which I will focus this presentation on. But I did just want to mention the other 3 dashboards, which are available to, again, anyone inside or outside of the council, built by the North East London ICB. And these are the PCN population profiles and the Population Health Explorer and the Population Health Metrics Viewer. A bit of a mouthful. I'm not going to talk about these, but I just wanted to flag that they are there. And if anyone does have any questions on those, I can answer them. So the 2 City and Hackney dashboards, they kind of say what they do on the tin. So the first is the Population in City and Hackney, which is a population-based tool. And that's really about who is living in City and Hackney. So it's all of the residents by wards and neighbourhoods. And this is based on census data and also the mid-year estimates. So it's all publicly available data. You can look at population trends and projections, so how the population has changed previously to now, and also how it's projected to change in the future. And then you can also look at residents by ethnic mix. And there's other information in there around number of births, deaths, and migration. The Health in the City and Hackney dashboard is a health-based tool. And this is really looking at what are the health conditions of our residents. And this looks at primary care data, so it's based on GP records. And in here, there's over 15 long-term conditions. So things like diabetes, asthma, depression, learning disabilities, so a wide range. And you can look at prevalence for City and Hackney, wards and neighbourhoods, and also prevalence by age groups, sex and ethnicity. So we can start to understand any health inequalities that exist in the borough. So the reason why we created these really is to empower our colleagues and frontline workers. We have access to a wide range of data and evidence in the public health team, and it's about sharing that knowledge and making it accessible to yourselves, and making it in a really easy to use resource. So you don't need a data expert like myself to use the dashboard, and then it can help you make informed data-driven decisions in your day-to-day work. So I put kind of 3 use cases of when you might use the dashboards, but I think there's probably more than I've managed to capture in this slide. But firstly, you can start to use dashboards to understand who's using your service. So you can look at the population in City and Hackney and compare the residents, by age and sex and ethnicity to who might be accessing your service. So for example, the population in Hackney might have 30% residents identifying as white, but in accessing your service, there might be 15%. So you can start to see if there's any maybe access barriers or disparities like that. You can understand the health of service users. So you can look at which health conditions are affecting Hackney residents the most, and see if there's any variation in people's outcomes based on demographics and who might be accessing your service as well. So for example, you can look at like children and young people and health conditions for those, or also maybe your service is only for women, and you can see which health conditions impact women the most in Hackney or in your locality. And also you could use the dashboard to evaluate any changes made in your service. So we've got trends over time, and you could see if there's been a change in any prevalence and condition following like an intervention or targeting of your service. There are many more slides to this, and I kind of wanted to develop it as a resource pack. So it does go into a lot of detail around what is in each dashboard. And I've listed kind of like what's in the dashboard, when you'd use it, why you'd use it, so what questions you can answer, and then how. And there's a slide for each dashboard, but I'm not going to go through this because I don't really want to talk at everyone. It's not going to be very interesting, but I will show the dashboards. So the dashboards are on our City and Hackney website, and I'll pop a link in the chat just in case people want to have a look. Let me just move on to my different screen. Yeah, so this is our website, and maybe it's a bit small. I'll just zoom in. It gives you a brief introduction of what the dashboard is. This is the population in City and Hackney, and you can download a training video and a how-to guide as well, so you can watch me use dashboard for some proper training. And I won't go through every single page, but this is just to give a brief idea of how you can use it. So the start pages will give you insight into what the tool is and also the different pages. So these boxes kind of act as like a contents page with a brief summary of what's included. So if I go to the first one, which is population estimates, this is where you can start filtering the dashboard to look at the number of residents in different areas by the year, age and sex. So for example, if I wanted to look at the number of residents in Hackney, I can click on this local authority toggle, which changes my map and bar chart to look at local authority level. And I can select Hackney, and you have the number of residents, so just over 260,000. We've also got like an age and sex breakdown of all of our residents. And you can do this by neighbourhood and ward as well, and it also ranks the different areas by number of residents. And you can filter this by changing the age. So if I wanted to look at children, young people, I can just move this along. So looking at 18-year-olds and under. And then again, all the data will change to show me these individuals. I'll move on to ethnic mix as well. So again, this can be used to compare who's accessing your service to the general population. So let's say I have a service in one of the wards, maybe Kings Park. I can see the proportion of residents by ethnic group in Kings Park. By the broad ethnic groups, you've got Asian, Black, Mixed, Other and White. But I can also select this plus button and get the more specific ethnicities in there as well. There are the other pages. I encourage you to have a play by yourself. I will move on to the health dashboard, which again is just on our website. And if you click population profiles, you can see them listed here. So moving on to health in the City and Hackney. And the format is generally the same. I'm just going to make this bigger so it's easier for everyone to see. Again, you've got the boxes acting as contents pages. And something I should have mentioned earlier is if you're ever stuck on a page and you're not sure about what's included, you can hover over this red icon at the top that says what's on this page. And it will give you a brief summary of the page you're viewing and also some information on how you can explore the data. So the different filters and how you can make the dashboard interactive. And then there's a section on understanding visuals where you can see detailed information on the charts and diagrams and some kind of insight on how to interpret the information. So if I move to the first page, which is health profiles, this will show all of the long-term conditions across City and Hackney, and it will rank the conditions by prevalence. So you can see in Hackney, the condition with the highest prevalence is hypertension, followed by depression, obesity, diabetes, etc. And again, you can switch this between wards and neighbourhoods. So if I move to neighbourhoods and select an area, so Clissold Park, you can again see the ranking for conditions in Clissold Park, and you can change the sex here and also the year as well to start interacting. And then the rest of the dashboard pages show breakdowns by age, ethnicity and deprivation. So you can start to look at the disparities between health within the borough. So if I select hypertension, for example, in the condition, using this filter here, that was our most prevalent. Maybe I'll choose a different neighbourhood. So I'm selecting the neighbourhood toggle. You can see here that hypertension, as you would expect, is much higher in the older age groups compared to the younger age groups. And this green line is an average for City and Hackney. So you can see that Hackney Marshes, has higher prevalence compared to the City and Hackney average. And you've also got trends over time here. It's more prevalent in females than males. So there's lots of information in here. I don't know if that was maybe a little bit too quick, but we do have training sessions on these. So if anyone would like training sessions in more detail of how to use these, you can email myself or the Public Health Intelligence team at Hackney, and we can go through these in more detail. I don't know if anyone has any specific questions at the moment.
Thanks, Sarah. That's great. It looks like a super useful resource. Yeah, we've spoken a lot in our team about wanting dashboards on things like poverty data and things like this. So yeah, it looks really useful. Does anyone have any questions for Sarah? I was actually wondering about, do you have a kind of, obviously it's just launched, but do you have kind of like a feedback mechanism at all? Like if we've got voluntary sector partners who are using it, do you have a way for them to feed into kind of possible improvements, or to share ways they are using it so you can sort of gather evidence, that sort of thing?
No, that's a really good point. And we do just say email the Public Health Intelligence team, but I think we need to put that on the dashboards themselves. So I'll just pop our email in the chat now.
Cool.
But yeah, direct email is the quickest way. There's 3 of us. We're normally very responsive, and we're really keen for feedback as well. I know there's a lot of dashboards around, but the benefit of ours is that you can directly feed into them. We will take user feedback on board.
Great, sounds good. Charlie.
Maybe this is a kind of council-y kind of question. What's the back end like? Is that Click, or is like how are you using to pull that data together? Or do you guys like R, don't you, in those languages in public health?
Yeah, we actually use Python, but this is built on Tableau and cool. Using SQL to pull from the secure databases.
Thanks, Charlie. Thanks, Sarah. Anyone else with any questions for Sarah? No? Okay. Well, thanks so much for coming along, Sarah, and we'll share your slides and the links in the poverty reduction newsletter as well.
Okay, thank you.
Not on the call. Great, thank you. Those were the 2 sort of planned presentations that we had for our meeting. Seeing as we've got a fair amount of time left, we thought it might be a good chance to, I know I'm springing this on you, Neil, so I'm giving you fair warning now, but we thought it might be a good opportunity to share, we've mentioned it before, but share, Jonathan's on the call as well, to share some of the work we've been doing around council tax. So I'm just going to try and, we've got a few slides, but we'll just do a bit of a whistle-stop tour. Just to share what we've been doing.
And it all started here. And that's why we're excited to share. And I hope you don't mind, Neil, but we're excited about the impact of this work. So I was just chatting to John and saying maybe we should talk about it here and update people. Neil.
So as long as we keep getting nice letters like we got from the food bank in, you keep cracking away with it. That's brilliant. Yeah,
absolutely. Yeah, and we've got Alex here, so Alex might have some first-hand experience of how it's working for residents as well from Hackney Food Bank, because this has been a piece of work that really originated here. Some of you have heard us tell a bit of this story before, but Neil was it was over a year ago now. It was well over a year ago now, wasn't it, before when we first started having the conversations. But I guess it really began here through Neil hearing a lot of the voluntary sector voices in terms of what was happening on the ground with residents and how complex their needs were. And coming to this session, recognising that many Hackney residents had long-standing council tax arrears made worse by poverty and the cost of living crisis. And then by the time that the new council tax increases were being sent to them, they were plunging further into debt. We were all worried about them in this session, and the voluntary sector were worried, and Neil was worried, and we were all trying to work out what we could do about it. We also knew many residents were reluctant to contact revenues, often being unaware of the support, settlements or payment plans that might be available, and so they might seek help from the voluntary sector instead. And if the voluntary sector didn't really know what was out there. They didn't know how to advise or how to support them. And so it was April 2024. So that's a year and a half ago. Neil came along and we began to explore with this group whether some of the members of this group would like to join a cross-sector working group that John led on with some support from a consultant that we brought in as part of a piece of work that we've been calling Fairer Ways of Working. And then the story picked up from there. John, do you want to take it from here? And I think we've got Jonathan Lang, we've got Alex, who wasn't involved in the piece of work, but hopefully Hackney Food Bank are benefiting. I hear great news stories there.
Sure. And yeah, Jonathan, feel free to chip in as and when you want to. But yeah, as Jenny said, we kind of brought together council services and people from the voluntary sector. So we obviously just started off talking about what our outcomes, what we wanted to get out of the project, really, what were the changes we wanted to see, and sort of had some very sort of honest discussions, really, from sort of both sides, as it were, in terms of, the council has this pressing need to improve council tax revenues. We all know the sort of financial predicament of local government, and we were kind of upfront and honest about that. But obviously the voluntary sector were coming with their experience of working with vulnerable residents on the ground who were struggling with council tax debt, and we got, as I said, had some pretty sort of frank discussions around those two aims, and realizing that we can do our best to achieve both of those outcomes working together, and that the council also wants to support residents too, of course, and that our voluntary sector partners also, I guess, gained a bit of understanding around the motivations of people at the council and vice versa as well. So that was a really good bedrock, really, to kick off the work. So they're just
to say, sorry, John, to interject. I was just going to say, it's fair to say that was not an easy process. It wasn't easy for us council officers to hear the critiques of the voluntary sector and to hear that, and it wasn't an easy process, was it? It was quite uncomfortable, wasn't it, John and Jonathan? It was, I think, lots of sort of having cups of tea and talking about the issue from lots of different angles were really important, weren't they? So.
Yeah, and I don't know if you're still on the call, Alex, but thank you very much for that feedback. That's really great to see in the chat.
I am on, John. At some point I'm going to be kicked off.
Yeah.
I just want to put the notes in there in case I can't be here to say we'll get more debts later.
Great, thanks, Alex. As we said, we formed a cross-sector working group. We had initial goals and ideas, but it was very much a sort of open process in terms of thinking about what we might want to get out of it. We didn't start with, we're going to do this, this, and this. It was about building that relationship and trust between everyone in the room and seeing what came out of that, really. Build on relationships. And really important, sounds kind of simple, but I'm sure you'll all appreciate, meeting in person and locally and often in community spaces as well, really helped build that atmosphere of kind of being like a little team, really, and wanting to sort of work together. Other factors that contributed to the success was, having Rebecca, who was our consultant, was acting as sort of neutral broker. She didn't have a foot in any of the camps, if you like, that were part of the project. We had sort of frontline and policy transformation here to help colleagues from the council as well. So sort of a range of perspectives. Tenacity, as we've kind of alluded to, it wasn't plain sailing all the way. We had bumps along the way. We had problems we had to solve, but through sort of working together and being clear on why we were doing it, we sort of managed to get to some really positive outcomes, which we'll get to shortly. Here's just a journey map, really. I won't go into detail, but you can see, it was a long-term piece of work.
And it shows the kind of iterative nature. It shows that like at each point when you did one bit, you learned from it and then came back together to think about what you could do next to build on it, didn't you? And I think that's so important to really take that learning, and then rather than, it wasn't something that could be planned out, like you said, from the beginning. So it was a very different method than we would usually use as council officers. Yeah,
exactly. In terms of our what sort of actually came out of it, the tangible sort of outputs, if you like, and these were all sort of co-produced ideas between everyone in the group. So we had we delivered some training for the voluntary sector around council tax and benefits, and importantly, that was very much a sort of co-produced slide deck and a co-produced way of delivering the training. So we had sort of expertise from the council's benefits and homelessness prevention training team and from Neil's service as well. But we had lots of great ideas and energy from the voluntary sector as well. So, you know, really about knowing your audience. We wanted to improve the understanding of the voluntary sector around council tax, and knowing how to pitch that and knowing the sorts of things that were most important to emphasise, you know, was only possible really from having our voluntary sector partners along that journey. So again, really keeping it focused on not perhaps always exactly what the council might have an idea about, but what the audience needs as well, and thinking about that. I mentioned the community money clinic before during Will's presentation, but yeah, this is fitting into all the outreach work that we discussed earlier around putting services in community spaces where residents are, and having a bit more of a wraparound holistic offer. So if someone's coming along to the food bank, yes, they can get their food parcel, which is obviously absolutely vital, but then there's this other support around council tax and benefits and things there as well. And we're sort of hopefully taking that forward as well. And then finally, the kind of one I think we're really excited about as well is our council tax escalation route. So this again was it's basically a way of raising council tax cases with the council tax team, with Jonathan and his team, where a resident is sort of particularly vulnerable or it's a really complex, serious case. And we've created this alternative route, basically, this alternative way to escalate those cases. So instead of partners perhaps being stuck on the phone for ages or going through the regular customer service routes, if you like, the way you can get sort of trapped in really long queues and waiting for responses, this is an alternative way of raising those cases where it needs an urgent look. So it's essentially a Google form, but it's something we really, again, co-produce with our partners. So we sort of came up with an idea of what we thought might be good on the form, and then they pulled it apart and told us where we needed to change it and make it more user-friendly and make it have all the questions that they would need to sort of answer when raising those cases. So this has been something which we've got sort of 10 or 12 partners using it at the moment. And we've had some really positive feedback from particularly the food bank and other partners who are saying it's really transformed the way that they're raising cases about council tax and really getting some really vital, important support to their residents in a much quicker, much easier way. And we've had a look at the cases that are being raised and some of the testimonies from people who have been using it. And yeah, it does really seem to be having a really significant impact. So if anyone on the call wants to have a chat about that, and if you're working with people who come to you with issues around council tax, then please get in touch with me and we can think about how to get you using this route as well. Neil or Jonathan, I don't know if you want to say anything at this point about the escalation route and how you're finding it sort of within the service.
Yeah, well, I'll say we're coping with the volumes. They're
right.
Lower than I actually expected, so that's good. We've only got a small team that handle the queries that come through, and they work on it on a rota basis. But yeah, we could take more if we had to. Yeah, it's really interesting, and the fact that we're reviewing all of the cases every couple of months as well. I think that's important to see how it's progressing, whether or not we are living up to our own expectations. Mm-hmm. And I mean, I need to look at the last couple of months worth actually, but you know, I might find something on there where we've helped the voluntary sector and they've been happy with what we've said. Actually, maybe we could have done something else, something just a little bit more. So and though when we learn that, then I share that with the team that are handling the queries, and we'll make it a better service still.
Yeah, thanks, Jonathan. And just to add on to that, we do have sort of a meeting every couple of months with everyone who's using the form, and Jonathan and his team and myself to get together and sort of have a review of how it's going, and if there's sort of queries or improvements that people think can be made to it. We, as Jonathan has said, we're kind of all ears to, to hear about that from the people who are actually using it. And it turned into a bit of a Q&A yesterday with Jonathan and the partners. He was fielding questions left, right, and centre, but he's the council tax oracle. So if you ever want anything to do with council tax answers, come along to those meetings, and Jonathan will help you out.
But it's been life-changing impacts that we've been hearing about, hasn't it? From the stories that we're hearing from the voluntary sector of just what it would have been like had we not had this in place for those families or for those individuals. I mean, it's been, I know. I think when I saw Hackney Playbus at the temporary accommodation drop in, they were just, they were so. They were like, this is life changing for people. Neil?
Just going to add in, I mean, this is sort of I'm not close enough as Jonathan is to see the people coming in, but I just wanted to sort of, for the voluntary sector, say, we're not looking for you to become the council, we want to work with you. I've had a massive learning on this. You wouldn't know it looking at my hairline, but I had worked in revenues for 30 years, and you become just, it's very difficult to see it from someone else's point of view when they're coming in. So that's where we want the voluntary sector to sort of to guide us and help us with that. And the aim of this all is that everyone's stretched, everyone's resources are going down. You've only got to read the budgets, what's happening in all the councils across London and the country, is that we don't want the voluntary sector to be the council. We want you to help the residents get the best from us. So this is where it kind of comes to that trusted partner relationship. It's working brilliantly with those we're doing it with so far. And as I, not wishing to overload Jonathan, but if there are voluntary sector people who we assume know the ins and outs of council tax, because we think, oh, they're helping people with it. That assumption was hugely wrong, and that's not a criticism. So we really want to help upskill that voluntary sector where we can, if the knowledge isn't there, because there's an assumption from me that it would be there. And it's just to say, I think I spent a lot of time praising my team, but I just wanted to help people say this wouldn't have worked without the voluntary sector and the honest approach they gave to us. So sometimes it was quite brutal, but we had to hear it. So I'd like us just to keep expanding that and keep working together to just keep this growing, because if it changes one life, brilliant. But I think we've got the capability here to, one, and I won't step away from it, collect more council tax. I've got to be honest, that is a motive of it. But two, it's making sure that those who aren't claiming the help get that help.
Yeah, absolutely.
So that's my speech done.
Thanks for saying that. And I think already, I mean, I was having a chat with Lee Giorgio in housing, sort of homelessness prevention and sharing, and suggested that he and, you know, that we connect on this, because I think that the escalation route could be replicated across lots of different services where there are real challenges in getting support to people. Similarly, like the training, the way that we've done the training here could be applied to training in lots of different areas where there are system blockers. So I think this has been really, thank you for being willing to give it a go, because it was quite a journey, all of you, and it took quite a lot of time. But I think we'll all agree that it was time well spent when you end up with these kind of impacts. So I'm really happy that we've had a chance to be able to do them. Really proud of the work that you've led, John and Neil and Jonathan and all the voluntary sector leaders in the space. Jonathan?
Yeah, I was just going to add that I actually found, although there was some difficulties, I actually found it quite freeing. So, for example, with the training side of it, I might not have expressed. I needed the voluntary sector people who were helping us to point out what I was thinking inside and hadn't said, because I mean, I recognise, for example, that our original version of the training package was too wordy. I could have coped with too wordy, because that's the way I am, really.
Yes,
and it's how we do stuff in the council. Yeah, but it was really refreshing to be able to have somebody who was working with us separate from us and say, actually, that needs tearing up and starting again almost. Yeah, because otherwise our both the support workers and their clients won't understand this. It needs to be in a different format, and so that was quite brilliant. I was quite happy that happened, to be honest, even though it was quite difficult.
Absolutely, that's brilliant to hear. It is I think it is liberating. We get so stuck in the way that we do things don't we? Just we need those different perspectives coming in because we haven't got all the answers. That's great. Charlie?
I've been doing some work with the voluntary sector again about consultation about the cost of living guide that we produce. I'm just sticking a link to that page in the chat. And Jonathan, the learning is very similar. They're selling us, you've got way too much, there's too many words here, you need to make it simpler, you need to use more symbols. So I think there's a lot of learning that's probably applicable for lots of other teams, just in that thread for you guys, and I'm seeing it in this work. So yeah, it's something we should keep in our heads all the time.
Yeah, absolutely. Thanks, Charlie. Oh, thanks,
Neil.
Neil.
Thanks so much for that, Susie. Yeah, did anyone have any questions about that piece of work, or yeah, any questions, any reflections, anyone interested in being a part of the escalation route, or any ideas about building on this work? No, that's all right. Oh, Claire.
Hi, yeah, I was just really what you said earlier around the discomfort, because often not through anybody's fault, it's not about individuals, it's about systems, and systems create barriers and kind of, you know, systems create ways of working that aren't always very helpful for residents. And just really wondered if there's any advice from Jonathan or Neil around their approach to this and some of the things they had to think about when they went into the room with the voluntary and community sector. Yeah, just because of, you know, it's not unusual for council officers to be very cautious about having very honest and open conversations with our voluntary and community sector partners. And it can, you know, and it's difficult not to personalise it, even though you can say it's not the people, it's the system. It's quite difficult when you're in the room. So anything really, words of advice that we can take away, I suppose, and share with other colleagues across the council around how to approach this.
Yeah. Be flexible and resilient. Yeah, I did have something that popped in my head and now it's disappeared out again. Yeah, it's gone. I'm really sorry. It might come back at an inappropriate moment or something.
Yeah,
I think one, you know, as was on one of those early slides, it did take quite a while to get to a shared understanding of like why we were doing it, if you see what I mean, and like for the VCS to understand what basically understanding like people in the council aren't, you know, bad people, as it were, to put it bluntly. Like they also want to do the right thing and do a good job, and for the council side to understand that the VCS is perhaps their knowledge around the context of the council tax system and the context the council was working in, that they had to also, you know, be humble as well and understand the challenges that the council were facing. So it did take quite a while to sort of break down some of those assumptions, I suppose, but you kind of just have to push through that, and you know, at the end of the day, people's good intentions will win out in the end, even if some of the conversations are difficult along the way. So I think it's just kind of sticking at it, and eventually you get to a point where everyone understands that people are sort of doing it for the right reasons. I think does that sort of chime with what you think, Jonathan?
Yeah, and I was thinking one of the assumptions that I had going into this, because we were talking about people with a lot of debt not paying us at all, or too scared to contact the council to start paying, or thinking that they couldn't afford it, and thinking that we were too intransigent and wouldn't allow arrangements for payments, for example. So, for example, we send a final notice and it says you have to pay the full year's balance in one go, and you've got to pay it within 7 days. Now, there is writing on the final notice to say, please contact us if you can't do this. But it wasn't noticed. And when we had the first meetings with the VCS, yeah, some of them thought that we didn't actually have an arrangements policy that we followed. for cases that are not the norm.
Yeah.
And so we had to, I was actually explaining, well, actually we can make an arrangement in those circumstances. We can spread payments over a lot longer period than you expect. All we need to have is the engagement and the information from the client or the customer to say what their whole situation is, so that we can look at both their income maximisation and also their, and get to what reductions we can apply that they might not have known about, and then get to a point where they're actually in a place where they can actually start paying an amount regularly, and that's all that we want.
So there's something about like recognizing what power you each hold, isn't it? In your reflections about it, recognizing that the VCS hold power that you don't, and knowledge and wisdom about, you know, or that can point to things that you can't, but it's also like them actually getting a chance to understand what you can do, what you can and can't do, the fact that you can do, and you know, that there are arrangements that you can make, because if they don't know that, they don't know what to recommend to residents or how to encourage them, because they don't want to be sending them to someone who's going to go, right, you need to pay 14 grand immediately or whatever. It's like
there's
they then do it.
There's a whole host of residents that don't trust the council, but they do trust the voluntary sector. And so therefore, if we can get, you know, closer ties in that way, and then they learn that, well, actually it's the council that's helping me, not just the support worker I've gone to, then hopefully the trust is built and they'll be able to come to us earlier than they might have otherwise done in the past. And that's what we want as well, is people to contact us at the earliest opportunity, not to wait till the last desperate point where perhaps the bailiffs have had to go around and knock on the door.
Absolutely. And where are you now as a group, of those of you that have been working on this? Like, where do you feel like you've got strong enough relationships that you might end up doing other bits of work together? I mean, you're already doing the community money clinic, you're still on the escalation route, but it feels like quite a strong kind of working team, doesn't it, between you?
Yeah, I mean,
that experience.
Go on, Jonathan, go
on. Well, it's got to the point where Krista's calling me a friend and putting a kiss on their emails.
That sounds like good working relationships.
And she was quite feisty at the beginning, I can tell you. You won't mind me saying.
Absolutely. But yeah, look at that, and look at what a journey travelled, because you've all had an experience of actually being able to make a difference together as well.
Yeah,
you've seen
that case where somebody owed tens of thousands of pounds, didn't she? And it all got wiped off in the end because we went through the right processes, getting the help that was available, that they didn't know was available, and then putting them in a completely different place. And I think that person ended up, they weren't working at the time, and now they are working as well.
There you go.
Completely turned around someone's life.
Absolutely. We need to pull those case studies together really clearly as well. This is just yes, the recording will be sent. Yuxel, nice to see you. I don't think we had a chance to connect. Thanks for joining us. So, yeah, the recording will be sent round with the newsletter that goes out after the meeting. But yeah, I guess this has been such a fascinating piece of work to learn from. Also, Jonathan, I think for all of us, for our team as well, and for those who have been involved from the voluntary sector, I know that Krista's doing some work with Charlie, but also really keen to do more of this kind of work. And I think that the experience, the voluntary sector who are involved, who aren't here, I think many of them aren't here. Alex wasn't he? But yeah, I think they've had such a positive experience, which will then translate into better, for all of us, I think better working relationships on these problems when they rise. So I'm really, I hope you can continue to work together and meet and keep developing more ways of doing more of these helpful things. But it seems like the escalation route might really be able to be built on, the success of it. We've got really good evidence so far, haven't we?
Yeah, I mean, that's the Stop the Knock team that are doing those pieces. We're already working in this holistic way, which the rest of the council tax team were not doing. I mean, I've been trying to get everybody to work in that way, but it's a hard thing when you're, it's a bit like turning a tanker around. But they're doing a great job, but it wasn't really advertised much. Now it's getting advertised a bit more through this way as route as well. And all I need, and so I need, it would be lovely to have that spread through all of the back office council tax and the customer service team as well.
Absolutely.
Sometime in the future, hopefully.
Yeah, definitely. But yeah, do get in touch with John or Jonathan if you want to be involved in this stuff. And Alex, I did want to, see, you had to drop off for a meeting, Alex Chase, didn't you? And you came back, but you posted in the chat. I wondered if you wanted to say anything about, your experience of this work.
I just think, just thank John and the team for it. I personally haven't been involved in it so much, just part of the back end. So I know John works with casework team, so John sort of sets up on the site. But the feedback I got when they returned was it was all very positive, and it was just the speed that could be done. So I just sort of highlighted again from what I said that the visitor turned up, they spoke to someone, they could see the file, pulled up the file, they could assess the case there and then, they could make the decision there and then, they could amend the invoice there and then, the debt was written off, amended, the payment plan was agreed there and then, so the visitor actually went away with a clear action that's happened, not more phone calls and just giving away the leaflet and a phone number and told to email someone and blah, 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 which just creates frustration within the system and of which the council, unfortunately, because it's the name above the door of the borough, is the one that gets most of the blame for it. So it's really nice and the feedback I got was really nice. The business came away going, wow, the council are actually really good, which makes a very nice change.
Getting some stuff sorted. Feels good, right? No wonder.
And then obviously just one of that was to stop the dot. Obviously, again, our paper team will be looking at some work came out recently nationally around councils using bailiffs to collect council tax. Obviously, there's the stress that causes the bailiffs coming up with the doors and things like that. And again, our team came back to our CEO and this is not something we see. As soon as we get Stop the Knock involved and Stop the Knock again actually doing what they say, and they ensure the bailiffs do not turn up. So once we get them engaged in that, they actually work and the job is done. So again, more positive feedback on that element. I think it's saying that every way in this list of playing they do what they say on the tin as opposed to say one thing and actually something different happens in reality. Thank you everyone for the work, and hopefully we'll see Joe and the team a couple of times at the next location. We've got 20 people regularly turning up, and a lot of people there have got debts and some other complex issues. So, and hopefully that will be another productive session for the team.
Great.
So thank you.
Thank you. No, it's great feedback. Maybe you should jointly write an article to tell other councils about the success of this piece of work. People.
I don't do writing. Writing is really bad. I can do talking, but not writing.
We'll take your feedback. We'll and John and Jonathan and team with Krista maybe write an article and share the learning from this. But yeah, if people have ideas on where we can let people know about this as well, let us know, because we really want to share the learning so people could do more of it. I think that there's definitely energy and appetite for it. And once done it.
Join the year, see what it takes further, do a trials and see what we can do further, because again, to come back from our visitors was they want more collective places where they can go access more support non-sitting and have that sort of thing. Think how we can grow the success and make it even better. So hopefully, let's get Christmas out of the way and all the demands and all the problems that come up down there. So and might have some capacity and hopefully.
Great.
If he's up for it. If he doesn't want to see it, then he can ignore my email.
Yeah, keep sending feedback in, and definitely keep coming to this meeting and keep involved all of you, because this is brilliant. We want to keep the pressure on, don't we? Thank you. Did anyone else want to come in on this? Anyone? I can see that we've got is that Ngozi from the Homerton Hospital? I think we've got Joycelyn from Shepherdfold. I was just wondering whether any of those might be potential escalation route points. I don't know if Homerton Hospital is set up yet through the poverty coordinator role. John, I don't know if they're one of our partners yet, but I guess we might want to be quite proactive about the different services that we could do with having access to it. And I don't know if Ngozi, if you're on the call and can come in if that's the same Ngozi from Homerton, but no, I'm just putting you on the spot. Or Joycelyn, you're probably doing other things in the background. That's totally fine. Or Titilayo. Titilayo's down at Hackney Arc these days, aren't you? I think people must be in camera off mode. That's all right. I had a go. Yeah. Did anyone else want to share anything on this or ask any more questions? Or
I don't think my internet is very good because I'm not off camera, but it's not really good. I'm not in the country, so I'm joining outside.
Oh, I hope you're somewhere lovely, Joycelyn. Oh, look, you look fabulous. You look like you're on holiday. Are you joining us from your holiday, Joycelyn? Is this because you're usually so busy and you can only join on holiday? Oh,
no, I'm still working.
Still working. Oh, it's really good to see you. I'm glad you're taking a holiday as well as working, though. I'm glad you're getting some holiday. You look fabulous. Yeah, so how's things going at Shepherd Fold? You do need a proper break without any of this working business. You shouldn't be thinking about Hackney. Where are you in the world?
I'm in Ghana.
You're in Ghana. You should be on the beach.
I've never been. Yeah, everything is fine. We are doing the cooking class for pregnant women and new mothers.
Oh, great.
And I've seen we are trying to introduce nutrition, food, and different culture as well.
Brilliant.
And engaging them as well to participate. So I was not there when they started, but during the feedback, I noticed that everything is going on well.
Right.
We are trying to reach out as many pregnant women and new mothers as possible.
Okay.
They are people a little bit difficult to reach out, but we are using approach of organizations that work with them, and also hospitals, children's centers, in order to reach out to them so that we can promote healthy food on a low budget to them and support them in area where we can.
Brilliant. Brilliant. Oh, well, maybe Hannah can connect you to it. But yeah, Hannah or I know Charlie's going off soon, but Hannah has been working with a lot of the organizations working with families in Hackney. So yeah, maybe Hannah can link you up with things. Yeah, if you let Hannah know if you need any links there, Joycelyn. I was wondering.
That'd be great. That'd be great. Just I understand the food shortage on our end. We are struggling to get food for our people because the people that needed the food are increasing. I understand for the past 2 weeks, they have been really struggle to provide food because the food we receive from Phyllis are always not enough.
Right.
But if I'm around, I always move around to see if I can reach out to street box and other people and other organizations and other partners to see if they have leftovers that can outsource it to support the people. But
the needs are really high. That's the needs are really high, and there's not enough food.
No, I understand there's not much food on our end, and we always have more people as we expecting. So I think when I'm back, I will reach out to John to find out about the council tax.
Great. I expect you will. Yeah, I expect there will be some people that you're working with who will be who could really benefit from this. So definitely worth having a chat and making sure that. Ngozi's mic's not working. Thanks for the chat message. Nice to see you. Yeah. But I think it's really. I think it can really make the difference when you come across those cases that are really difficult, and we're trying to strengthen more of those links. We've also been suggesting that some of our colleagues in children's services get in touch with you, Joycelyn, about engagement.
Yes, I will share the leaflet with John, and maybe you can help me to share it around. That was part of my top of my to-do list today, to send it off so that we can share. But it's going on well, and I have a good cook and a nutritionist that they are really, really good. And I believe people that will join will be very helpful.
Yeah, Fantastic. And when is it starting, these sessions?
They started 2 weeks ago on Wednesday,
Right.
last week
Wow.
Wednesday, and yeah, at least they have about 5
Yeah.
people join. We don't want to open it to public because of the safety reasons and health reasons. So we want to maintain those. We want to maintain the newborn mothers because they do breastfeeding and all that. So we have somebody specially that working with them. Because of their breastfeeding, they have to, we have to have our approach very carefully, and also pregnant women, we have to tread carefully. So we want to maintain those 2 groups. So we don't want to open it publicly, match people that we don't, but so far it's working well.
Brilliant. Oh, I'm really pleased. It sounds like it's such an important time to be supporting people, isn't it? And such a transition time in your life, having a new baby and getting that support early on to get the food right and the budget. And I know you're not just going to be providing that as well. I know with everything that you do, you're always, if people come with needs, you're always, whatever those needs are, you're trying to
other needs are, we're working alongside with other needs that will be needed. But what I've noticed on my center with all these people that are sourcing our service, sometimes if the pregnancy is new, yes, they normally come around, but with time we don't see them anymore. And when they have a babies as well, we don't see them. So I see this project as a very, very important on my end and my best of knowledge. Those people are always lack the support that are available because if they have newborn, like I was saying, that when you have a newborn, it's difficult, and when you are pregnant, it's difficult because it's not any food that you can eat. It's not where you feel like going. You feel withdrawn, you feel by yourself, and all those changes in your body. So I believe most of the support, they are always lag behind, not receiving much.
Oh, interesting. We should
from the community. So I think it's very important that we take this opportunity to reach out to them,
definitely,
so that they too can benefit from the support available.
Yeah, and it's a good time to know where the services are as well when you have a new baby, so to navigate lots of different services. So it's a good chance to make sure they know where the help is. And I think we should connect you to Louisa in the family hubs. So the children and family hubs, there's 4 of them, but they're going to be trying to do more from those hubs, and they want to have those relationships with organizations that are doing what you're doing too. So they have lots of resources that some of those families could benefit from. So it would be really good to link you better with the closer family hub to where you're working with Louisa. I can connect you. And Titilayo is asking, hi, do
you support
new mothers with children with disabilities?
No, but I can refer them because I asked the grants management to help me with other support available for those mothers. So I can link them up to where they can get help, but not my end supporting them. No, I'm trying to pull up more resources that they can benefit from. So I'm trying, because there are some benefit they are not aware, like a healthy start and all that grants of 500, and some of them are not available. So I asked them to put them down so that when I come over, I can be able to help them to apply for some other things that they can benefit from. So I'm trying my best to pull out as much information that they need, and also share it with them and see if they can help them to get something out.
Titilayo.
Hi everyone. I thank you.
I don't know if it's my laptop. I can't hear you properly.
No, I can't hear you properly either, Titilayo.
Can you hear me now?
Yes, much
Hi
better.
Everyone. I said it's been so busy. I was trying to have something to eat. I haven't had anything all day. But Jocelyn, thank you. I was gonna ask, so how then can I get in touch with you on behalf of the family, or can the family get in touch with your service? Or do you want me to write to you if we have any needs, any mothers with needs. Would that be a good idea to link with you first?
Yeah, sure.
Okay.
Sure, yeah. You can maybe John can, let me see if I can go. My internet is not good.
Okay.
I hope
think
I'm not cracking.
write
My
it in
internet
the-
is very bad.
Okay.
Yeah.
Okay.
I'm putting my which I believe John Davis will do it later, but I'm just trying to put my email address here.
Okay. Thank you.
Yeah. So you can reach out to me and we'll see what we can do together.
Okay. Thank
And
you.
mind you, if somebody come over, they have issues.
Hmm.
I come across one of them that have disability child.
Okay.
I think it's autism, something like that.
Autism. Yeah, we get quite a few of that.
Yeah, I got a mother that one I was there when she was registering, and I understand she's attending the session. So such people might need extra help that I don't know. So I'm trying to observing their needs. I'm trying to
Okay.
pull out
Let's see if you can
information.
meet the needs. Okay.
Exactly, information that will be relevant because I don't normally see them on my center. And so when I saw this grant, I think it's the best opportunity to reach out to those people and see what we can do as a community organization to help them. So yeah, so that I don't know how isolated that they are, but I believe they need help because I don't see them much in my center.
Okay. Yeah, I mean, these families have lots of needs, and it'd be nice. I know that they can be supported one way or the other. Yeah. Thank you.
Thank you.
Yeah.
And thanks, thanks, Joyce, for telling us about that. I'll send an email to you to introduce you to Louisa and Hannah to make sure you've got Hannah's email, because I think they might be able to make sure that, just make sure you've got all the information about what's available locally and anything and the right link into the family hubs in case families have other needs or if there's resources, because they have things like the Alexander Rose vouchers there, and they have different, there's some free childcare for some families depending on their circumstances, and a lot of the time, like you say, they don't always know about it. So if you're working with some mothers that begin to trust you, new mothers, then it's a really great thing to be able to link them from there to the hubs and what's in there as well. Brilliant. Does anyone have any questions for Joycelyn about that work or any thoughts there?
I was just going to say quickly, Joycelyn, if there was, I wasn't quite sure, if there was something you wanted to share and promote, if you send it to Chanel Paul, I put her email address in the chat, because Chanel puts together the newsletter and I'm going on leave from tomorrow. So yeah, if that was what you were looking for, then please email Chanel. Her email's in the chat.
Okay.
Yeah, that would be great. But if you don't want everybody to refer to you, Joycelyn, just say what you want. So if it's like, please send me mothers who really need this, or because if you don't want, just make it clear what kind of referrals you want, so people don't think that everyone could, because it sounds like you have quite a small group, and you can only take a certain number, and maybe it's only appropriate for some parents or whatever. So maybe just tell us in the newsletter, just put a line when you email Chanel to sort of say, send me these people. So you get
Chanel.Paul.
Chanel.Paul, yeah.
Oh, okay.
Yeah. Great. Thank you. Brilliant. Anyone else want to come in? This has been a really rich session. It's been great to see you all, as always. And we won't have John for the next session. Is that right, John?
Yeah, I'm on annual leave for the next one. So our colleague Daniel, who's one of our management trainees at the council, will be facilitating. So be gentle.
He was here earlier. So he knows.
Daniel was here earlier, so he's been on these sessions before. So yeah, he'll be facilitating the next one. But yeah, I'll be back for the one after.
Brilliant. Any final words from anyone? Anyone want to update on anything, or any final words or reflections or connections or ideas? Charlie. Oh, thanks to Talayo. He definitely does.
I flagged it at the beginning of the call, but just to say, All the publicly available energy advice sessions are on the Love Hackney website. So some of you will have had visits from Crew Energy in the past over the last year. We know that they're very popular, but if you're having a resident who's really struggling with getting access to energy advice, that we have residents and like advisors in the libraries multiple days a week from different services. And that's all public on that link I just shared.
Oh, and lastly, I guess I just want to say this is actually going to be my last tools session with John. And I wanted to big up the fact that we have had 3.5 years of tools for frontline staff sessions. I'm going to be leaving the organisation in a couple of weeks.
No.
I'm
happy you bring that up or not.
I wanted you guys to be the first to know. I'm letting people know. Thank you. Listen, the work continues. You're the real champions here, and I'm just.
It's been nice knowing you and working with you. You've been absolutely a star, and all the best wherever you're going.
Thank you. Thank you. I'll be carrying on this important work in one way or another, and I won't be far. And Hackney's always in my heart because. It's been the most phenomenal experience working with all of you. Since the pandemic, and working alongside my amazing colleague Claire, who's on the call. So anything that you might think to ask me about, go to Claire. If you can't go to Charlie or Hannah or John, or not that I want to inundate Claire, but Claire and I have worked in tandem since the pandemic on this stuff. So what we've learned. And with all the amazing work that Charlie and Hannah and everybody have been doing, the ripples from this work keep going, and I think it's been such an honor and a privilege working with you all. But I will be at the last session. John just won't be here. I'll be at the session in 2 weeks' time, which I think will be my last week. So come back for my last tools session.
Seeing you there.
Long may the tools session continue. Please help John to keep the spirit and the energy going, and keep this lovely collaborative culture going, and maybe even take it in turns chairing it so that John can get a break sometimes. Because it's your session too. You've been making this all the way along, and I just think you're all awesome and you do such excellent work. So I'm super proud to have had the chance to work with you all. So sorry to sort of like take up the end of a session with that bit.
Not at all, well said.
And it's been a blast doing this with you, John. You've done an amazing job holding this space. Like it just keeps going. You keep showing up, so we keep doing it. So. As soon as people stop coming, it will just come to an end. So you just have to keep going, and then it will keep going, and no one will be able to shut it down, no matter who leaves. Thank you so much, everyone.
Thanks, Jenny. It's been great. Been great working together in these spaces, and sorry, it's sad that it'll be our last one together, but it's been a fantastic experience working with you. So
you too. And I will tell this group about my leaving do, which will probably be on the 28th of November, and I'd love to see members of this group in person. I think in the town hall we're going to have lunch. Joycelyn, if you can make it, Jonathan, all of you, I'd love to see you. If not, I'll see you at the next tools in a couple of weeks, and I won't be far. I'll probably still watch your tools sessions on YouTube just for drinks on me, exactly.
Jenny, please send the details, please.
I will. I'd love to see you. You've got time for tea and cake.
Thank you.
Thank you all so much.
Thanks, everyone.
Thank you. Thanks so much.
Bye, everyone.
Bye. Bye.
Oh, thank you.
Bye. Bye.